Good evening, Los Angeles, and thank you again for joining us at City Hall. We are lucky to call Los Angeles home. It's a city of doers and dreamers, innovators who will innovation on the streets and the places of LA almost every day. Many of our brightest and most creative minds are right here at our local universities, and one of them, the University of Southern California, I'm proud to have represented here tonight by its president, Dr. Carol Folt, a friend, already a great Angeleno, as we discuss tonight how we are helping fight on during this pandemic, a way that we can bring together the resources of this great city to ensure that we have the data that we need, the suggestions and policies that we require, and the programs to make sure that this day is one of the worst, and every day moving forward is a better and better day. We also have Dr. Paul Simon, who is Chief Science Officer at the extraordinary Los Angeles County Department of Public Health. He works very closely with our office here in the city, and he's an adjunct professor in the Department of Epidemiology at the UCLA Fielding School of Public Health. And we're also joined by a Trojan, Dr. Niraj Sood, who is the Vice Dean for Research at USC's Saul Price School of Public Policy. These are two incredible leaders and two incredible doctors who can speak to the medical efforts that we are undertaking right now. And they're going to be available also for the press to answer some of your questions you may have here today. And I want to thank all three of them for joining us here tonight. And let me also give a shout out to our incredible team at the city's Department of Information Technology and Channel 35, who ensures that this broadcast through all of the channels of our local stations gets there. We couldn't do it without the camera operators, the editors, everybody who has made this possible. Thank you for making sure Angelenos can hear the most important news they need to know. Before we hear from Dr. Folt and from our panelists, I'd like to first discuss, as I always do, the latest data that came in here today, data that you need to know to understand this crisis moving forward. So let's start. Today, there were 472 new confirmed positive COVID-19 cases in the county of Los Angeles, bringing our total number of cases to 10,496, a 4% increase since yesterday. For comparison, the past 7 days had seen an average daily increase of 437 new cases. In the city, there were 245 new cases today, bringing the total to 4,707, a 5.5% increase since yesterday. And most tragically, of course, we learned today of 42 new deaths. This is 42 new Angelenos who lost their life because of COVID-19. It brings the total to 402, a 12% increase since yesterday, and unfortunately the highest number of deaths that we have had to face. The past 7 days have seen an average daily increase of 29 new deaths. The doubling rate of our deaths has slowed a bit, with deaths doubling every 6 days now, but the last 2 days show that the number of deaths are not slowing. These are now our worst 2 days back to back. And as I always say, and as Dr. Freire often says too, these are not numbers, these are people. These are not statistics, these are stories and our lives. People that we know, people who we love. I've spoken with husbands who have lost their wives. I've talked to girlfriends who have lost their loved ones, parents who no longer have a child, and children who no longer have a parent. Across the county in our general emergency hospitals, though, we continue to build capacity to save lives. There are now 1,553 beds available, including 1,309 acute care beds and 244 ICU beds, and an inventory of 996 available ventilators. We're looking to continue to keep folks healthy, safe, and out of those hospital beds, and testing, we know, is a vital tool in that. So let me next turn to our testing. I'm proud to say we now have 30 testing locations across the city and the county. 3 more county sites opened today at the Forum, Bellflower Civic Center, and the San Gabriel Valley Airport. And we now have the capacity to test 10,700 people a day. And by the end of the day, we will have tested approximately 56,000 people here through those centers. On top of that, probably about 30,000 more have been tested through our providers. So more than 85,000 tests to date in LA County. Testing is critical, But I want to remind you that it depends on you. If you have symptoms, please get a test. Don't wait until somebody says go. If you're feeling those symptoms, do it today, because we don't want unused test kits at the end of each day due to folks thinking that mild symptoms are no problem. We need to know, not just for you, to make sure that it doesn't get worse, but we need to know if you're positive so we can contact people you've come into contact with. You may have a very mild case of it, but getting that test ensures us we know that you're for sure positive, and public health can then trace and track the people you've come into contact with and quarantine them. Simply put, testing saves lives. So go today, because anyone with symptoms in LA County can get a free test, and you go to coronavirus.lacity.org/testing to sign up for a test right now. We know that some of the worst days of this crisis are still ahead, but there are encouraging signs that the swift action we have all taken is flattening the curve. So folks are now asking, what comes next? How can we get more of our lives and our economy back on track? And how can we be prepared for future waves, potentially, of COVID-19? You see, one of the biggest tragedies of this crisis is that we simply don't know when we'll be able to come back together again, to see each other, hold each other, smile in 3 dimensions at each other. Getting back to when we can be back in a classroom, or out on date night at a bar or a restaurant, catch a game at Dodger Stadium or Staples Center. This will require a lot of steps in the days ahead. And getting back to some of those things will take longer than others, and we will always be guided by the health professionals, the public health professionals, in the steps that we take. Nobody was looking forward more to an LA NBA champion or World Series winner than me. But let's be clear, right now there are no small gatherings, and getting back to medium and large gatherings will take time. But day-to-day snapshots or estimates are less important than the work that we can do to make sure we are back in stadiums and arenas, bars and restaurants, back seeing our loved ones who are seniors sooner than later. And while we don't know what any date will be today, we do know that the more we do now, the sooner those dates will come. So while we've been reacting to this crisis by saving lives today, we're also simultaneously thinking about what we need to do for tomorrow, to reopen up Los Angeles, to get back to school, to get back to work, to get back into public spaces, and what we need to be able to do that safely. Yesterday, Governor Newsom, along with his counterparts in Oregon and Washington, unveiled thoughtful and necessary goals that are required to reopen the economy. These steps zero in on testing, preventing infection among high-risk groups, hospital capacity and the ability to handle surges, the availability of therapeutics, medicine, and vaccines, adoption of physical distancing measures in businesses and schools, and the ability to kind of snap back to reinstitute safer-at-home measures when necessary. We need these clear guidelines in place to restore a sense of normalcy and prepare for a second and even potentially third wave of COVID-19. Consistent with Governor Newsom's approach, I want to take a second tonight and share with you 5 pillars of our strategy that we're considering here and talking to leaders across the country about in order to return to good health and to more prosperity in Los Angeles. First is testing. So we all know, but it is a critical requirement that we have widespread testing for everyone with COVID-19 symptoms and for also asymptomatic people with significant risks of transmission. There should be strong national standards for the quality and the reliability of tests and federal support to guarantee supplies are affordable and available at the local level. Now remember, when we're talking about testing, we're really talking about 2 different kinds of tests. First, virology tests, which are the ones that are conducted usually with a nasal or a mouth swab to detect the presence of the SARS-2 novel coronavirus that can confirm whether somebody may be infectious with COVID-19, whether they have symptoms or not. This helps us track and trace and isolate people as well as their contacts so they can be quarantined. And then the second type of tests are serology or blood tests that draw blood from a finger prick or a syringe to detect the presence of antibodies that have been produced in reaction to the presence of the novel coronavirus. These antibodies can tell us who has had this coronavirus or COVID-19 and assess their potential immunity or track and trace people they have come in contact with because we didn't know that they were sick. These blood tests are the easiest way to see how many people have had the presence of the novel coronavirus, but do not, I repeat, do not necessarily, as Dr. Ferrer has said many times, speak to someone's infectiousness. Virology, the swab tests, if you will, are better. They are a point-in-time test. Serology is really a historical test. And serology tests still have a way to go to be produced en masse and with close to 100% reliability. But we know that they will be critical in the steps ahead. We will need this strong system of testing before LA will be safe to reopen. Second, real-time surveillance is needed for us to be able to detect and prevent new outbreaks. We need to link test results to a surveillance network so COVID-19 can be tracked in real time. We can quickly detect new hotspots, maybe quicker than a human eye can see them. For instance, an outbreak in a neighborhood or a senior care facility, so we can quickly go to the third pillar, immediately respond to new cases with even more aggressive approach than we have today. This is about building a greater ability to quickly isolate cases, trace and communicate with contacts, and quarantine non-immune individuals who have been exposed to COVID-19. Doing this means some workers will need to be trained for urgently needed new jobs to supplement the incredible work being done by our public health professionals. We've seen in San Francisco, librarians, medical students get enlisted. One estimate is that 300,000 Americans, many out of work who could potentially have new jobs like they're doing in Boston right now, can help make sure we track and trace more quickly and more extensively. Fourth is the question of hospital capacity. This pandemic has laid bare our hospital bed shortage. We shouldn't have to scramble like this. And here in Los Angeles and California, luckily the actions we've taken and the great work by our hospitals to expand that capacity has let us keep up with the increasing demand of patients in our hospitals. But we need a national push to grow the capacity in ICUs, emergency rooms, and supplies like PPE now before the next wave hits. And then fifth, the last piece is ongoing research and development. Our country, and certainly this region, has a remarkable history of being innovators. That's how I started my speech tonight. And we know that top scientists with federally backed research can help develop treatments in universities like USC and UCLA here and throughout the country. We need to make sure that treatments and vaccines and cures to terrible diseases in the past, that brilliance is put here as it is being done for COVID-19. And we need the CDC and others to support standardized data collection and to closely collaborate with states, universities, and labs to effectively develop treatments, not based on theories, but on actual clinical trials. And then to share that information with doctors and nurses on the front lines. These 5 principles are the principles guiding us here in Los Angeles, as we will make those decisions about how and when we can begin to get back to work and back to school, back to fun, back to the life that we had before all of this. But together with the key measures our governor outlined and that we are exploring, namely how do we keep protecting those high-risk members of our society even as we open up parts of it, are going to be very important in the days ahead. So let me return to blood testing, because I've asked Dr. Fulton, her colleagues here today, to speak a little bit about this in a moment. We know that blood testing is critical in looking at immunity, helping identify Americans who might be able to serve in workplaces or classrooms and roles that may otherwise create significant risk of transmission in the days ahead. The existing tests are still not good enough and not widespread enough. We need a better ability to measure antibodies and understand and test results translate into how test results might translate into actual immunity. And blood tests might give us critical information like who might have plasma that can help guide our research and protect more people and save more patients. And we know that our progress depends on powerful partnerships between government and the private sector. And so tonight we're very proud to highlight a partnership between the County Department of Public Health, my office, USC, and Lieberman Research Worldwide in Century City, as well as collaborators at UCLA and Stanford, to address serology and the tests that will measure antibodies in the blood, tests that will help us move from crisis to recovery and to see how many people, in fact, are infected or have been infected with this novel coronavirus. This partnership will accelerate research and development and help us answer questions that are key to what you want to hear. When, Mayor, are we going to get back to normal? So to say a few words, I'd like to turn it over now to a great leader. As I mentioned, she's been a leader not only in education, in higher education, but here already in Los Angeles. somebody who's been extraordinary in everything from the environment to ensuring that her workers have the dignity that they need and the resources they need in this crisis. I want to thank you, Dr. Folt, and ask you to say a few words. Madam President.
Thank you, Mr. Mayor, for your leadership and for your partnership. Even though Los Angeles is practicing social distancing, collaborations like this are bringing us much closer, and we're learning how to do it on warp speed. So it's really important for us. This study is led by USC Price professor Niraj Sood, and this antibody study will provide critical information for us and for the rest of the world on how to combat this pandemic and find a pathway to potential end of this crisis. It's a unique partnership between USC and the Los Angeles County Public Health Department, and it shows how much can be achieved when we work together. Since last weekend and just over the next few weeks, Professor Sood and his team are already testing a representative number of people across Los Angeles County to determine what proportion of Angelenos have been infected with COVID-19. And I want to have a special thanks to the Keck USC medical student, Peggy Ebner, because she jumped right in with a number of her fellow medical students to volunteer to assist Dr. Sood in performing these tests at sites around Los Angeles. The data that they are gathering will absolutely help us better understand just how contagious and deadly the virus is so that our hospitals, our public officials, and the public can plan accordingly. The study will help us identify people who can also donate their plasma to fuel new treatments for COVID-19. In the future, Dr. Sood and his collaborators hope to make antibody testing available to every Angeleno. And this would be so helpful. It would help ease anxiety for people who are worried about contracting the virus, and it will also be an important fundamental step towards restarting our economy. And I just want to thank everyone who's been working on this amazing collaborative effort, Dr. Sood and his team, including his collaborators at Stanford and UCLA, Mayor Garcetti and the Los Angeles County Department of Public Health, LA City Council member-elect Kevin DeLeon, and U.S. Schwarzenegger Institute. Since the crisis began, USC has been so proud to be on the front lines with healthcare workers at Keck Medicine of USC, at the LA County, and other hospitals to support our neighbors in this difficult time and to partner on vitally important studies and initiatives like this. Thank you, Mr. Mayor.
Thank you so much, President Folt, and thank you for everything that USC is doing and our incredible academic community across Los Angeles. We've had so many, not only offers of help, but people that are working on our most vulnerable folks and financial assistance, economists who are looking at our current unemployment, who are suggesting policies to move forward, and we look forward to those robust partnerships growing even more in the days ahead. And as I reminded folks who are from the media, the two doctors that are here are available for questions at the end too. So they're not just here to sit and to smile, but I hope that you'll ask them some interesting questions that we can dig in a little further on some of these medical issues. With that, let me share a couple last updates as well on our ongoing work to provide relief to folks, because while we look at the medical aspects and the public health aspects of this, we know folks are suffering out there in Los Angeles. All of our work is focused on saving lives, but we know that seniors have been particularly hard hit by this crisis. Every day under normal circumstances, our Department of Aging provides meals to our low-income older adults across the city. And many seniors who receive those meals, usually at our community centers and senior centers, obviously couldn't go anymore to those places. And while they can't have those conversations with their friends and some of the great memories that they have through our usual program, we have continued through our Safer at Home directive to feed those 5,000 seniors across this city. And this pandemic is disproportionately causing stress to the population, pushing more seniors into food insecurity. And our office has heard from so many people who relied on this service who are now struggling to secure food on a regular basis. These are our grandparents and parents. These are our friends and neighbors. As I mentioned, prior to this crisis, we were feeding about 5,000 seniors a meal a day. And tonight, I'm proud to announce a new initiative that we've already started with help from the Mayor's Fund for Los Angeles to bridge the gap for these seniors and others. And this is our Emergency Senior Meals Response. This initiative will double the number of meals that seniors already enrolled receive in the department's program. And to get this, we will formalize a partnership with an amazing LA entity, Every Table, which is going to make this food. But we're also excited to say we're going to double the number, more than double the number of seniors that we will serve. 7,000 plus additional seniors, meaning that 12,000 plus seniors will now be a part of this program. Thank you also to Access Services, our service providers. Access Services, which traditionally provides transportation for people with disabilities, are stepping up to deliver these meals along with our traditional service providers as well. So whether it's St. Barnabas or Watts Labor Community Action Committee, folks at home can make sure that they are safe from COVID-19 and at the same time make sure that that doesn't come at the cost of receiving food. And so we will now be sending 10 meals a week to more than 12,000 homebound seniors. And there's really only 2 requirements for this. It's really easy. Doesn't matter what zip code you're in the city of Los Angeles. There's 2 requirements. You have to be 60 or over and live in the city of LA. That's it. So if you're interested in joining, and thanks again to our providers, Every Table, Access Paratransit, and more, please call, starting tomorrow between 9 and 5, 213-263-5226. If you need meals and you're 60 or over in the city of Los Angeles, call 213-263-5226 beginning at 9 o'clock tomorrow. And stay tuned for more, because we've been talking to the governor and the state to see how we can expand food security even more for our seniors, and we hope to have some exciting announcements in the days ahead. These are just the first steps that we're taking to expand our capacity and to meet the needs of our senior population. But I'm committed to making sure that Angelenos of every age and at every stage of their life have the resources they need to take care of their basic needs. That includes financial well-being. Today is April 15th. This would usually be a stressful day called Tax Day. But this year, I want to remind you that the deadline to file your taxes has been moved to July 15th to provide more flexibility and time as Americans confront a new financial reality. We've heard from Angelenos who are worried that a later tax day will mean that they won't receive their stimulus money from the federal government. Don't worry. The two are not related. You will still receive your stimulus check. And here's what you should know. First, if you are eligible for those funds from the federal government, even if you haven't filed your taxes yet for 2019, the IRS will make a calculation based on your 2018 filing and send it with the information on file. And second, if you don't ordinarily file federal income taxes because your annual income is below the requirement, you can still file a simple return for this year and make sure that you get the money that your household qualifies for, up to $1,200 per adult and $500 per child. You're entitled to this money. All of us who have paid taxes over the years, this is our money coming back from Washington at a time of need. And we have partners here to help you at Free Tax Prep LA to make sure that they can answer your questions on this or anything else. So go to lamayor.org/freetaxprep, and tools and information are there available for you, as well as people who can follow up. Delivering economic relief is part of our responsibility to all Angelenos, and I believe nobody should be left behind. This includes nearly 700,000 DACA recipients across the United States whose fate hangs in the balance at the Supreme Court, and the more than 82,000 of those DACA recipients who call the LA area home. As the grandson of an immigrant who came over the border, fleeing war, his mother carrying him in her arms as a baby, I shudder to think about what would happen if they were separated, or if this country hadn't given him the opportunity to join the U.S. Army, become a citizen. I literally wouldn't be here today as your mayor. But in the midst of a pandemic, we can't let anyone's fear about immigration policies or anything else let them be afraid to seek medical care. And we can't afford to have healthcare workers feel fearful to show up to work. People who clean the hospitals, people who serve in the hospitals, people who are making sure that our markets work and our warehouses are functioning. That's why this week I led a group of 52 mayors from across the country sending a letter to the Department of Homeland Security urging them to keep protections in place and to automatically renew any DACA employment authorization documents that expire this year. From day one, state and local leaders have led the response to COVID-19, and that's not just the case here at home, it's the case around the world. And as I've mentioned throughout this, I've convened Zoom meetings and participated in Zoom meetings with mayors across the country, the 13 mayors of the most populous cities up and down the state, And today I had my second call with dozens of mayors from around the world. The mayor of London, the mayor of Melbourne, the mayor of Milan, the mayor of Curitiba and Guadalajara, and many others, who are comparing notes about what they are doing to open up their economies and to think about the future. We had a presentation from Singapore to learn about their public health system and the things that they are doing. And we heard from folks who are battling the economic duress that everybody is experiencing in their cities. This effort is absolutely critical because none of us stand alone, not us in our neighborhoods or across our city, not in our state or our country, nor in this world. If there's one thing I've learned from this, it's that we need to be even more tightly connected. This virus reminded us of how tightly connected we are across the world. It is now time for us to make sure that the answers and solutions come from that same shared network as well. We will get through this, and when time comes to move into the recovery phase, we have to address the core inequities that allowed this crisis to hit some Angelenos harder than others, to stay focused on what we can do to protect our health, to get people back to work, and accelerate our action to address things like the climate crisis and other public health emergencies we have, from homelessness to a warming globe. But we're reminded that we are in this together. Every night that you invite me into your home, it's a reminder that we are part of one city, a city of angels, a city that will soar again, a city that has the brilliance and the courage and the grit to not only get through this, but to see a better day. My commitment to you is to fight and to work every single day for that, to make sure that your city government continues to function, to meet your needs around COVID-19, and then to rebuild this great city, and to look back and say, while this was one of the toughest chapters, it was one of the strongest and greatest chapters that this city has ever seen. So, as I always say, let's keep it up and stay safe, stay healthy, and stay at home. Strength and love to each one of you in Los Angeles. President Folt, myself, and the doctors would be happy to answer any questions. Thank you. I'll take the first question.
Thank you. And the first question comes from Jory Rand from ABC7. Please go ahead.
Hold on 1 second before you ask the question. I'm going to actually ask the two doctors to introduce themselves because I know I can see them, but there you might not be able to. So Dr. Simon and Dr. Sood, would you just briefly introduce yourselves and then we'll take your question, Jory.
Sure. Hello, I'm Dr. Paul Simon with the Los Angeles County Department of Public Health.
Hi, I'm Professor Neeraj Sood from the University of Southern California, and I'm co-leading the study with Dr. Paul Simon from LA County Public Health.
Thank you both. Go ahead, Jory. Sorry about that.
I'm sorry, Jory must have disconnected. We'll now go to the line of Alex Michelson from Fox 11 News.
We'll get you back, Jory. Don't worry. Go ahead, Alex.
Hi, Mayor. And as a Trojan, I love the USC theme tonight. So fight on to all the Trojans in the House, including our President Folt. And like most Trojans, we want to go see football games this fall at USC. Like most Laker fans, we want to go to Staples Center and to see them or the Clippers win the title this year. We want to see the Dodgers win the World Series. There's a lot of speculation about what's going to happen on that front. So can you level with us, and how realistic is it that we're actually going to be able to go to sports games this fall, the concerts people want to go see, such an important source of revenue for people this fall? And to that point, if we can't, what do you think about sports without a crowd? And one last follow-up on that point. Looking back, knowing what we know now, was having the LA Marathon when we did, was that a mistake?
Sure. So on that last one, no, we talked to public health, and because runners are spaced out and people took that, it did not look like it was. It was one of the last actually great things we had before we had cases come here, and we have not traced a cluster of cases back to the marathon at all. Second, you raise a great point. And as I said, I know it made some news, something that I said in response to a question from one of our general managers, where I said it was going to be difficult to imagine this year going back to the largest gatherings we have. That became suddenly any concerts and any sporting events in any way. All I know is while we don't know the date when those things will return, I know that they will be sooner the more that we take these actions. And not just of physical distancing, but getting a testing regime up from our federal government, from making sure that we have not only the virology tests, but the serology tests, that we develop rules of the road for schools and for workplaces to get people back, that we figure out whether things like immunity passports will work, that we make sure that we keep our most vulnerable safe. And I certainly would love to see some sports games and concerts later this year, whether that means that those are athletes playing by themselves. President Folt and I were just talking about this before the press conference, because that's the recommendation of our public health professionals that allow us to see it on TV, or whether that can be potentially in person. But I think we're a long way off from huge gatherings. We are not as long away from medium-sized gatherings, and we're still today not at a place of even small gatherings. So these are steps that we will have to take. I will always level with people to let them know that things aren't coming quickly, and we can't reopen things simply because our hearts say that we want to. I will always listen to the doctors. I will always listen to public health. I don't know if Dr. Simon wants to add anything to that, or Dr. Folt, but I'm happy to have them. Dr. Simon?
Sure, I'm happy to comment. I think the important point is we can't predict the future. I think we have to take it week by week. We use the best available data, the best available information on how we distance and what the impacts of those interventions are. I think if we do scale back, it will be in a very gradual and strategic way. We certainly don't want to endanger folks, particularly those who are most vulnerable.
Thank you. All right, we'll take the next question.
Thank you, and that goes to the line of Jory Rand from ABC 7.
Sorry about that, Jory. Welcome back.
Appreciate it. Can you guys hear me okay?
Yeah, we can hear you great.
Okay, fantastic. This is a little bit of piggybacking on the last question, but there are people who want to see society and business open now. A vast majority of Americans say they're fine with safer-at-home orders, but there are some people out there who are contacting us, and I'm sure you saw what happened in Michigan today, where groups shut down parts of the capital city in protest of stay-at-home orders there. So maybe people here aren't going that far, but can you speak to that question of why some of those non-essential businesses can't reopen now if they implement the safe practices of using masks and physical distancing and limiting numbers inside combined with the testing? And what do you say to those who just say if people want to go outside and risk their own health, why not just go ahead and let them? Thank you.
Sure, and I'm sure Dr. Simon might want to add to this, because I've heard Dr. Ferrer talk about this. This isn't just about your life. This is about other people's lives too. This is about people who you know and love, who you care about. Half of our households have somebody over 65 or the pre-existing medical vulnerability. So we know that this is something that isn't just about whether you'll take a risk on yourself, but your actions could wind up spreading and killing others. And that's why it's absolutely critical that we listen to public health advice and professionals, not for us to just go on our own instincts here. That said, I will always continue pushing strongly on what we need to do. If there are measures we can take that get us there sooner, I'm not going to be passive about those things. I'm going to ask Washington for that help. I'm going to ask Sacramento for that help. I'm going to talk to mayors around the world about what those best practices are, because I don't want one more day to go by than it has to, that we stay at home and that our livelihoods are endangered the way they are. But we all know that if we let this be a medical disaster, that is the worst thing for our economy. It is the worst thing for our lives, and that's the only thing we can never restore, a lost life. Dr. Simon, is there anything you want to add to that?
Well, I would just say we're relatively early into the pandemic. We're still seeing deaths, the numbers of people dying going up. We've seen a leveling of reported cases of COVID. That's a good sign. I really want to commend the general public. They've been incredibly responsive, and we understand it's a hardship. I know people are suffering. There's certainly economic consequences, but also the psychological consequences, and we understand that, and we're with you. We want to try to open things up as quickly as possible, but we have to be very cautious.
Thank you. Take the next question. Thank you.
Thank you, and that comes from the line of Mary Beth McDade from KTLA Channel 5 News.
Hey, Mary Beth.
Please go ahead.
Hi, Mr. Mayor. Well, you do sound better today. I hope you're feeling better
Feeling
today.
great. Feeling strong.
Also, a couple different things.
Sure.
Just wanted to find out, it seems that testing is just so key as far as getting things reopened. I'm wondering, I'm hearing you say we're now up to 10,700 tests that we can do daily. Is there a number that we need to see? How many tests do we need to be able to do per day in order to reopen the economy? Second question also, I know we were just talking about the study for the antibodies and what have you at USC. Wondering when can we expect some of those results from that study? And then lastly, I know City Councilman Joe Buscaiano is using some funds, and he's using them towards restaurants to make meals for the homeless. And so he's helping give some business to restaurants, also helping out the homeless in need. Just listening to your initiative as far as helping out these seniors, why not expand that across the city where some funds can go to these restaurants, have them make meals for the homeless and seniors?
So let me start with that. I think probably Dr. Sood can speak to the study and the timeline. By the way, I want to thank Joe Buscaino, Paul Krikorian, Marquise Harris Dawson, so many folks, and I think elected officials across the county who've stepped up to help support local restaurants. We've done that through the mayor's office as well. And like I said, hold tight for just a couple more days because we're finalizing some negotiations with FEMA and the state, something that will be good news for folks who need meals and good news for our restaurants, as well as our hospitality workers, many of them who are out of work right now. But it can't announce tonight, but we have been absolutely doing that. I think Joe's program isn't just for the homeless, but for families that are facing food insecurity and making sure they get restaurant-delivered meals, and it's been a real model. And Paul Krikorian is really playing a strong role in leading overall our city's response to helping that happen and looking at those workers that are out of work right now, whether they're hotel and restaurant workers, whether they're taxi drivers. We think that in the next couple of days we'll have, I've given you enough clues, but something good to announce that will expand what we talked about for seniors even further. The first question let me take, and then I'll hand the second one to Dr. Sood. Look, it's not, the tests and the number of tests don't lead to reopening. There isn't a magical number of tests that lead to reopening. For instance, there's many more tests in New York City. They have the most probably per capita of any city, though we're coming close. But those tests are showing many more positive cases. To put it in perspective, as many cases as we have in LA County is the number of deaths that New York City has had. It's devastating there. I was in communication with Mayor de Blasio today, and we talked, and it just, my heart goes out to that city and to him and to Governor Cuomo and everybody who's dealing with that. So I think Dr. Simon, Dr. Frere would be the first to say it's not the number of tests. Tests can inform, but that won't lead to the opening. It's the number of cases and then the protections that we have. And one of the protections that we may have is knowing what is the incidence of cases out there, which is exactly what the study is. So I hope I've queued that up for you, Dr. Sood. Why don't you take it from there?
Yes, so what we're trying to do in the study is try to measure the true extent of COVID infection in the population. So we not only want to understand how many symptomatic cases there are, those are the ones that are typically reported to LA County Public Health, but in partnership with LA County Public Health, we want to also track the asymptomatic cases or the mild cases with mild symptoms that were never reported. So the true goal of the study is to really understand the extent of the infection today, and also to trace it over time, so that we heard questions about when is the economy going to open. To really answer that question in a scientific way, we need to track what's happening to this epidemic. Are the number of cases rising over time? Are they falling over time? When will the number of cases start to kind of go down? So that's what we're trying to do with the study. And there was a question about, when are we going to see the results? Well, as soon as possible. I know the numbers from the study are vital for guiding public health decisions and public policy decisions, and therefore it's important to really vet those results, make sure other scientists look at them before we start making decisions based on those results. And that's the process we are undergoing right now. We've completed the data collection, but we're analyzing the data and sharing it with other scientists and making sure the conclusions we are drawing from the data are accurate before we start making decisions based on them.
Thank you so much, Dr. Sood. And I want to thank Dr. Folt, because when I heard about this from Dr. Simon, and I think originally it was going to be funded to do once a month, I called Dr. Folt. I said, this is something we need to fund more often. She stepped up, and I want to thank USC and the USC community for agreeing to do that, so that this is something every couple weeks now that we can get this data. Because for decision makers like me, knowing those percentages are going to be critically important. And one last thing I'll add that I think I talked about 2 nights ago was there was one projection that was shared with me recently that said that if we keep on where we are today, this is about managing our hospital capacity, right? We don't ever want there to be somebody sick who needs to get to an ICU or use a ventilator who can't. And so far, we've been able to keep that flow going. But if we keep with what we're doing, about 30% of people, was one rough estimate, would have contracted this by August 1st in Los Angeles County. Now, we'll be able to see whether that projection is actually accurate as we begin to have these blood tests. This projection also said if we stopped and opened up the economy right now, 95% of us, that's 9.5 million people, would have COVID-19 before August or by August 1st. Needless to say, that would be a disaster and overwhelming for our medical system. It would cause deaths unnecessarily. It would be extreme suffering. We could tighten things up even more than what we have today. Sometimes people ask, why aren't you doing more? And that would lead to only about 5% in this projection of people having been COVID-19 positive by August 1st. What that would mean is it's probably slower to reopen up the economy because 95% of us would still be vulnerable to a second spike. So this is about balancing that, and this information is going to be absolutely critical for us making these decisions. I hope that's all helpful. We'll take the next question. Thanks.
Thank you, and that comes from the line of Leslie Marin from CBS KCAL. Please go ahead.
Hey.
Hi, Mayor. Just wanted to talk about the Angelino card that you talked about. We know that the website has had some issues with people just trying to log on, maybe too many people trying to get that. Can you tell me if you plan to extend that deadline?
So the deadline will stay the same. That's through tomorrow. We did initially have such an overwhelming response, which speaks to just the need out there for folks to make their most basic needs met. And I was very glad to see the governor, by the way, announce another charitable undertaking to give cash assistance, including to undocumented Californians and others that they're seeking to raise, which would also be about $100 million throughout the state. And I think they've raised $5 million so far, and they're going to continue forward. All of these things are incredibly helpful. I know they're being done in the Bay Area as well. But we had 133,299 applications yesterday. 159,052 today. That's a total of 292,351 applications. We want to make clear it's going to be one per household. If there's more than the cards available, that will be done at random, so it will be done in a fair way. And people shouldn't be worried if they haven't gotten through yet, whether it's on the phone or the internet side. That will stay open through tomorrow at 4:30, and that's when we will close it. That will be, it's already more than there is money. That's why I want people to continue giving to help Angelinos, whether you can give $1 million and you're listening and call us, or whether it's somebody who can give $5 and you log on to mayorsfundla.org and give to the Angelino Fund. We're not going to stop just after that first round, but we will start that money being given out as early as the beginning part of next week. And it just speaks to the need. And I hope that our federal government is listening too, because while we get the checks that many people who are taxpayers will get, folks who haven't paid taxes in the traditional way or too low in the poverty line to have received that, and others who are hard workers and pay taxes but are undocumented also deserve to make sure their families are fed. So that is something that will stay. We're not going to extend that for this round, but I hope if we can replenish that and raise another $10 million, we'll do it again and again and again. Thank you. Next question.
And that comes from the line of Robert Kovacic from NBC.
Hey, Rob.
Mayor, how are you, sir?
Good. How you doing?
Quick question for you, and then I'd like to speak with the doctors, if I may. Okay. Mayor, I didn't quite get an answer, or maybe I didn't hear from being so far away, regarding large gatherings when it comes to sporting events. Will you subscribe to whether it's high school teams or professional teams playing despite not having an audience? And would you subscribe and think that that would be an idea as we move forward?
Absolutely. If our public health professionals say that it's good and that we can, for instance, test everybody that's on a team and they say it's safe, absolutely. I think that's probably something that we will see before we see stadiums full.
Doctors, thank you very much for chatting with us. There seems to be a lot of belief among people that we have spoken to at NBC4 that there is going to be a reluctance overall for people to begin a new normal until there actually is a vaccine. And we know that that could be a year and a half at the earliest, correct? With that said, is there a way that you can see people trying to go ahead with their lives as these restrictions are lifted, and what would you recommend to them, especially in light of the fact that Mayor Garcetti himself has warned us that we can expect to go back inside
at least one more time, perhaps two more times, due to coronavirus?
So I think what I'd say is COVID-19 is still a new disease, and we're still trying to understand what it would do. So I don't think we don't know for sure that we would need a vaccine to get back to normal. There is a likelihood that we might be able to get back to normal much earlier than that. But we still don't know how much time that would take, whether that might happen in a month or that might happen in 2 months. And that's why we need the science to track the epidemic, to figure out how many people are getting infected, how are the number of infections changing over time, do we start seeing the number of infections go down over time, and as we start seeing infections go down, we know then that's a safe time to try to re-enter or restart the economy. So I think we have to do this in a scientific way, but hopefully we don't have to wait for a vaccine for 18 months. I think there is a good chance that this might happen earlier than that.
So let me just add one more thing. I think we need to distinguish between the antibody test and the PCR test, and they complement each other, but I think very importantly we have to expand access to the PCR test and be very quick about testing folks who have symptoms, and if identified with the infection, isolating them, identifying their contacts, quarantining them. I think Dr. Frieden, the former director of the CDC, described it as putting a box around the virus. If we can do that effectively, that then frees up other folks to have more freedom in terms of their movement.
Okay. Thank you. We'll take the next question.
Thank you, and that comes from the line of Claudia Pashuda from KNX News Radio. Please.
Hi, Claudia.
Hi. There is now an outbreak. We know of at least one outbreak on Skid Row, 6 people at the Union Rescue Mission, including one person who died. And advocates for homeless people keep calling on you to commandeer hotel rooms and more quickly move to get people off the streets. So I'm wondering, given evidence of this outbreak, if there's any thought of doing that at this point?
Sure. I think that was, if I'm not mistaken, something from 10 days ago. There was an employee, not somebody who was experiencing homelessness, but who lived there at the mission. And that area up where they lived in kind of a dorm setting, everybody was quarantined there. I hadn't heard about the death, though, if that is the case. My heart breaks for not only the mission that has been providing so much help over the years, but who has been at the front line of this. I know they're trying to set up their own testing facility, but we haven't waited, and we have started testing, as I mentioned last week, handing out tests to the doctors and the clinics that serve our unhoused Angelenos. It's been a very high priority since January for me that we have this plan in place. In terms of commandeering, I would just say, look, we still have to pay for things. And so we have to make sure that we have the money from the state and the federal government through our county for these hotel and motel rooms. But I've put such a priority on this that we put kind of a czar from the city side on charge of this, just in terms of calling more hotels, calling more motels, offering not only just to have hotel rooms now, but potentially to purchase those hotels and motels so that people after this is done don't hit the streets again. Been working very closely with Judge Carter. We've put out over 300 sanitation stations, over 50 of those on Skid Row. They're being serviced once a week. Now they're being serviced daily. Over 50 porta potties there alone and other things for sanitation. And we'll be rolling out later this week and hold till the end of the week until we can announce it kind of formally, but the sort of testing we need that will give quicker results on the street for folks. One last thing is all of the folks from LAHSA and our service agencies have moved from general education outreach to now really trying to find cases among unsheltered Angelenos. They've been doing that now for a number of days, actually since last week. And the folks who have come in, nearly 1,000 into our new congregate shelters at our rec centers, also have access to nurses, to testing, and quick resolution, because people will come down with COVID-19 even in those congregate settings, but they're much safer there than on the streets. Lastly, the hotel rooms right now, we don't have them filled. So we need to expand them and fill them. And I would implore everybody who's working in that homeless services space, and I know what amazing work they're doing from LAHSA, from the county and others, to continue getting people more quickly into those rooms. So it's not about commandeering more rooms. It's not like there's a list of 2,000 people and we only have 1,000 rooms. It's the opposite. There's right now 1,765 rooms that have been booked. 841 of those are in the city for asymptomatic people. So these are folks who don't have a home, don't have COVID-19 symptoms, but we need to get them inside. And the Tier 2 housing, which is hotel and motel rooms for people who do have symptoms. Right now, there's 900 of those, 512 in the city, and 153 of those are currently occupied. So the capacity is kept up, but I share their concerns. We can't get too many rooms too quickly. My goal, and what I heard the county and state talk about, was 15,000, and that's what we need to keep gunning for, and I certainly will continue to. Next question, please.
Thank you, and that comes from the line of Melanie Mason from the Los Angeles Times. Please go ahead.
Hey, Melanie.
Hi, two quick questions with regards to the antibody study. The first, Mr. Mayor, what exactly is the city's role with the study? Are you anticipating contributing financial resources, more manpower? And secondly, to either you or to Dr. Simon, obviously this test is for research purposes. This is a random sample, but there are people who are seeking out this test for their own personal information. And I'm wondering if the city or the county has looked into ramping up the availability for residents to be able to obtain these antibody tests. Obviously, interest is quite high in finding out this information.
So let me answer the first and a little bit of the second and toss it over to Dr. Simon. We need more clarity, though we've had some good initial conversations with FEMA about whether the serology tests will be also reimbursable. For folks who don't know this, every night that I talk about these tests, including tests for people who don't live in the city of Los Angeles, we're fronting that money and we're only getting reimbursed 75% of that. So 25% of every test, and they're not cheap, but this is about saving lives. We've just dug into our city funds, and I've said, I don't care. I know that we're going to have financial difficulties in the year ahead, but we have to save lives and bend this curve, so we've been spending that money. We need to get answers about serology, and it is my hope the federal government will help it not only expand, but through employers and folks who don't have employers who can pay, making it free with 100% reimbursement for local counties and cities that are willing to do these tests, that we will have the resources to do that. In terms of the tests, it was something that Dr. Simon was talking to me about. I've talked to a number of people that were doing these, and I said, tell me what the details are. Can I help get you those resources? I made a pitch, I think, 2 weeks ago on camera for anybody who wanted to pay for this, so it wouldn't be just once a month. And then I called Dr. Folt, mentioned that this was happening at her great university, and said, can we work together to find donors? She said, we've got this covered. So I didn't play more of a role than just kind of pushing people along, but I'm really proud that this is not something that will be done, every 4 weeks, but now half or twice as often, excuse me. And I want to thank you again for that, Dr. Folt. Dr. Simon, why don't I toss it over to you, or to Neeraj, you want to take that one?
Well, I'll just talk briefly about the scaling up in the population. I'll let Dr. Sood talk about the study, but I would say an imperfect test works fine in a research study because in the analysis you can sort of account for that inaccuracy. But when you're dealing with an individual patient, you have to be right. And so I'm very concerned that the quality of the tests out there right now are highly variable, very little oversight at this point. We're looking to the federal government to give us some guidance on which are the very best tests. And I think once we do have confidence that these tests can deliver results to patients and others that are accurate, we see much value in trying to expand the testing.
I can just say that, ever since word got out that I'm involved in this study, my email is filled with requests from Los Angelinos saying they want to participate in this study, or they just want to know, they want to peek inside their immune system, and they want to know whether or not they have these antibodies. There is a lot of anxiety around COVID, and I feel that once we have validated tests, it is really important to provide access to these tests to every Los Angelino, so that every Angelino, so that they know what's going on inside their body, they know how much protection they have from a potential reinfection from COVID. So I think this is important both for easing anxiety as well as eventually reopening the economy. We want people who are potentially immune from this, or at least have significant protection from COVID-19. And as the mayor said, we want to do the PCR test at the same time to make sure they don't have the ability to infect others. So if we can identify a population that doesn't infect others or has a low risk of infecting others because their PCR test was negative, and with a valid antibody test, we can identify a population that also is potentially immune. These are the individuals who can actually be on the front lines, take care of the elderly, take care of people in ICUs, and restart our economy. So that is the long run hope for what we hope to achieve with this study and beyond.
Thank you, doctors. And just to that question, the point that Dr. Simon made, there are so many of those tests out there. We keep hearing about the reliability. I believe only 3 of them have been approved for diagnostic use in the United States, 9 of them for diagnostic use around the world, 24 for surveillance and research only, not for diagnostic reasons, and there's 11 that are under development. There's a website at Johns Hopkins that is monitoring all the serology tests where I got those numbers. But we want to make sure that they're reliable, we want to make sure that they're available, we want to make sure that they're affordable, and we need to have them quick. That's what we're all gunning for. Next question, please.
Thank you, and that comes from Dennis Freeman from News for Us Online. Please go ahead.
Hey, Dennis.
Good afternoon, Mayor. I have 2 questions for you. The first question is, in regards to social distancing, what is the city's approach when it comes to the 2 major summer holidays that's coming up, Memorial Day and the 4th of July holiday? And the second question is, what is the city's approach, what has been the city's approach as far as testing the homeless?
Thank you. So in terms of social distancing or physical distancing, as I sometimes refer to it, it's too early to say for Memorial Day or the 4th of July. We're trying to get to May 15th, which is when the county and city's safer at home order is extended to. And we're going to be talking closely to public health the entire way. And those of us like Supervisor Barger, myself, the 87 other mayors of other cities in LA County are in constant communication about, okay, is it time to take any baby steps, either forward or backwards? So I wish I could answer that, but it is too early to say for those both of those occasions. In terms of the testing individuals who are experiencing homelessness, so we have had a number of tests already go through. I think the numbers were, we had over 230 tests that we have done. I think the numbers, I'll try to get you the exact numbers, but the ones that have come back have been over 95% negative, only about 5% positive cases. We've been able to isolate and use those, and track them, excuse me. The county has at Dockweiler Beach trailers that are used for isolation, though I think the preference these days is the hotel rooms that are so-called Tier 2 rooms for folks that aren't just experiencing homelessness. It may be Angelenos that don't have a place to quarantine or self-isolate. They're going into those hotel and motel rooms. And our plan is to do more rapid street testing as we get that equipment and those tests. In the meantime, we've given out hundreds more tests to providers, doctors who work all the time with people who are experiencing homelessness, from Venice to Skid Row, the San Fernando Valley, South Los Angeles. And remember, the walk-up centers we're opening, we have now 2 of them. It doesn't matter if you don't have a car, obviously, you can come to that. And even the drive-through centers, we've had some people walk up to. So we are making sure that anybody who's experiencing homelessness knows they deserve a test, it's free, you can get it, and if necessary, we can even arrange for transportation through one of the drive-through sites. So I'll get you more numbers of the overall. The county has also confirmed a number of positive cases. I believe it's 24 positive cases of people who are experiencing homelessness now, and it shows us, as I've said each day, just statistically, this was something that started and was found first with people who were housed and has gone to the street. I know a lot of times people think that people experiencing homelessness are the ones that bring public health issues to us, but it's been vice versa. We've brought it to the street, those of us that are housed, and I think we owe everybody who's on the street the same protections we're affording those of us who are indoors and have a place to go to home. Thank you. Go to the next question, please.
Thank you, and that comes from David Zanazer from the Los Angeles Times.
Hey, Dave.
Go ahead, sir.
Hi.
How are you?
So last month you told us that crime was down 23%, in large part because there's a lot of people staying inside, behaving themselves. And I'm wondering, given those kinds of numbers, does it make sense right now to scale back spending at the LAPD, particularly given the city's financial problems? And if you're not planning any cuts at the LAPD, where are you going to find reductions given the police make up such a big piece of the budget?
So there will naturally be less overtime used. There'll be savings when we don't have the resources that we need because people are staying at home and safer at home. But that's across the board. All departments, LAPD, and every other one of the 37 departments of the City of Los Angeles have been asked to find savings wherever they can, to know that there's no new funding this year, to stop any new programs, to implement a hiring freeze right away. So those things apply to the police department as well as to all of our other departments. And we'll have to figure that out as we go. I have to release a budget this coming week. I mean, talk about the most difficult timing. In 2008, when we faced the Great Recession, we had to sit down. We had to cut programs. We had to reduce hours. I talked with those mayors internationally. I talked to the mayor of Vancouver, where they already laid people off. Some cities are so dependent on sales tax or on hotel taxes, even more than we are, for instance, that they are going to see deeper cuts, fundamental services cut in cities across the country and across the world. We're going to try to protect as much of those core services as we can. This city will never stop functioning. We're going to pick up your trash, your lights, your water will be there. We're going to make sure that your 911 calls are answered, et cetera. But we will have to look at that, and we'll have to sit down with our labor partners. We'll have to look at our services and what we think is absolutely critical in the year ahead. But make no mistake, there will be big cuts. Thankfully, one last thing, we have double the reserve fund that we had before 2008. You don't get any credit for raising the reserve fund each year. I know we've talked about it. It's something I've been very proud of. Our budget chair, Paul Krikorian, and the City Council has been a zealot about this. And thanks to him and the other council members and the work that we've done, we now have dollars that at least can soften that blow. It won't mean no cuts. It won't mean that we don't have service cutbacks and other things that we'll have to look at with shared sacrifice. But it does mean that we're in a much better place than we would have been had we stayed at a level that we were just a few years ago. Thank you. Next question.
Thank you, and that comes from Steve Gregory of KFI News.
Hey, Steve, you got a question for President Folt?
No, I'm sorry. It's going to be
She's
for
doing such a
you,
great
Eric,
job. Okay,
and,
no problem.
It's sort of touching on my colleague from the Times question as well. You
Sure.
were talking about budget cutbacks and savings and what you're going to have to do along the way. But at what point, though, essential employees, essential services, you've got the parks closed, you've got the golf courses closed, things of that nature. At what point where you'll have to start furloughing employees? And do you expect any of the higher paid employees and staffers to take voluntary pay cuts?
So, the pay cuts have to be something that can't be just voluntarily done. That has to be negotiated. Certainly, if you look at the Great Recession 2008, furloughs were a critical part of balancing that budget. Right now, everything is on the table and us putting together this budget in the next few days and finalizing that. So I don't have anything to announce on that yet, but I think that these are the things every city government around the country is faced with right now. And I'll tell you one thing that would help us not have those cuts and not have as deep furloughs or any other measures we might have to take is if Congress, as has been proposed by both Speaker Pelosi and Chuck Schumer, and this should not be a partisan issue, even though they're the ones who have pushed this, don't think just about federal government and businesses, but think about state and local government. Because we've been the ones on the front line. It is our firefighters who are putting their health on the line at our testing centers. It is our folks who are going out there from the public health agencies, making sure that they track and trace this. And if we let our city governments and our county governments and our state governments go down some sort of financial hardship, we will see not only job loss, we will see further blow to the economy. These are folks that are breadwinners for their families, and we want to try to protect all jobs, whether they're private, public, whether it's undocumented workers, folks that are citizens, people who are independent contractors, or whether they work for a big company. If we don't put those all together and not leave any of those out, we will certainly see a much tougher climb out of this in the days ahead. So I would urge every member of Congress, no matter what party you are, no matter which house, and our president, to make sure in this next round, as is being proposed in what was put forward, that there be not just assistance to reimburse us for what we're doing with COVID-19, but direct fiscal assistance for our cities and counties. Thanks. Next question.
Thank you. And our final question in English comes from the line of Jacqueline Cosgrove from the Los Angeles Times.
Hey, Jacqueline, how you doing?
Hi, Mayor. Thank you so much for your time.
Of course.
I wanted to ask you about something you said earlier in the news conference. You said we have not traced a cluster back to the marathon, and I was curious about how we know that information. I didn't know if that was because of contact tracing that's being done with people
Yes.
who test positive in Los Angeles, or how exactly we know, because this is a topic that we've gotten quite a few reader questions about, and so just wanted to understand how we knew that there weren't any clusters associated with the marathon. Thank you so much.
Sure, that was something that I raised with our county officials early on, and I was told that by one of our supervisors. I don't know if County Public Health and Dr. Simon wants to say that, but we always say in science, you don't know that something hasn't happened, but we have no evidence of that happening. And we've had nothing in terms of the tracing that I was told about that went back to that. But I don't know if you want to add anything more to that, Dr. Simon?
That you can't prove a negative. We can only try to acknowledge a finding, and we've not been aware of any clusters or outbreaks associated with the marathon.
And remember, that was before, I think, I have to look at the dates, before there was any community spread. I think our first case of community spread came shortly after that. It was the same weekend as we had NBA games and other things, so the marathon wasn't unique. There were still a lot of things that were happening, but as Dr. Simon said, we can never disprove that negative. I'm sure people will still theorize about that, but that wasn't the only thing that went on in the city, but it came just before we became the first big city in America to shut things down after Seattle on March 15th, the date we shut down most of the city, and 4 days later put the full safer-at-home order in place. Thanks for that, and I think we might have one Spanish question as well. Next question.
We do have a question for the Spanish at this time, and that goes from the line of Victor Cordero from Estrella TV. Please go ahead.
Hey, Victor. Buenas tardes. Victor, are you there? Victor? All right.
I don't know. I think we lost him.
Okay.
We can move to the line of Denora Perez from Telemundo. Please go ahead.
Hi, Denora.
Hi, Mayor. We got a call from a viewer telling us that she had seen many folks sunbathing in public in one of the local parks in Los Feliz. She said that there was many people gathering around, kids playing. And what would you tell those folks? Should they be wearing masks if they're biking, going for a run, or just sitting in the grass area? And then also if you can comment in Spanish in regards to the public gatherings and the possibility of these being suspended until 2021. So I'll ask it in Spanish as well. Una televidente nos llamó y nos dijo que había gente tomando sol en trajes de baño públicos, sentados en áreas verdes de parques, muchos sin máscaras. ¿Qué le diría usted sobre eso? Y tienen que andar con máscaras si andan corriendo, andan en bicicleta o simplemente sentados en los parques. Y también si puede comentarnos sobre los eventos públicos, si se van a ver suspendidos de aquí al próximo año.
Thank you. Let me start by just thanking again Dr. Folt, who has been here this whole time. I'm going to let her also, as I go into Spanish remarks in a second, get back to the important work that she's doing at USC, and thank again both of our doctors for the exceptional work that they are doing to understand this, to track this, and to save lives. I want to thank you both. So I'll answer both those questions in English. I'll go to Spanish, and then I'll give my Spanish remarks as well. So first of all, in English, our parks do remain open with the requirement. All of our, of course, facilities at them are closed, whether it's playgrounds, whether it's our rec centers. No sports are allowed, team sports or group sports. We don't even have our golf courses or our tennis courts open. But you are permitted to be in the park. I don't know what the spacing was, but if people felt that people were closer, not from a family unit or something, than 6 feet, please do let us know, because we have park staff monitoring that all the time, 3 times a day actually at all our parks, measuring the number of people, reporting that back, so that we can help our business ambassadors, our park rangers, and our Rec and Parks folks let people know about what safe distancing is. In terms of wearing masks, the facial coverings, the non-medical masks, no, it has not been the recommendation from Dr. Ferrer, from us, that when you're biking by yourself, running by yourself, or walking in your neighborhood by yourself, or with the person you're cohabitating with, that you need to have that on. This is for when you go to interactions, closer than 6 feet with people that you don't usually interact with, whether that's an employee or other customers at a grocery store, whether that's somebody who's working on a construction site, whether you're a driver or rider in a taxi or ride share at a hotel, and the other places that the county and city orders specify. So I know there's a lot of people who say, hey, I see all these people and they're not wearing their mask while they're jogging. It's important to remember these masks can also carry germs. So don't use them day after day. Wash them each day. Don't put them down in strange spaces or places. And wear them just where we are requiring them, because that's where they're going to have the effect of not spreading this disease. And in terms of the public gatherings, I've already said in English, so I'll say that in Spanish. So I'll transition now to Spanish. Thank you again, everybody who has tuned in English. Thank you, as always, to our interpreters as well. And let me answer both those questions. Gracias, Danora, por estas preguntas. Nuestros parques están abiertos. So, este caso de este parque en Los Feliz, no sé los detalles, pero están abiertos. Pero nuestro equipo, los trabajadores del gobierno de Los Ángeles, nuestros asistentes en nuestras facilidades de recreación y parques, cada día reportan los números de personas, y es importante mantener la sana distancia en nuestros parques. Las facilidades no están abiertas, los gimnasios, todos los partidos y otras cosas que usualmente queremos y tenemos no están en estos parques ahora. Y no es necesario tener una mascarilla cuando usted está en una bicicleta o corriendo, solamente cuando nosotros estamos en los espacios como supermercados, farmacias y otros lugares donde hay personas que no son parte de su familia. Es necesario por los trabajadores y la gente en estos espacios a tener sus mascarillas. La segunda pregunta fue de los eventos de deportes, de música. No sé el futuro, pero yo sé que nuestras acciones ahora pueden asistir y ayudar un día donde nosotros podemos regresar a una vida normal. Espero que nosotros podemos estar en Staples Center o el estadio de Dodgers en el futuro, o tal vez los jugadores estarán en estos espacios sin los espectadores. Pero nuestras acciones hoy son el futuro es el resultado de nuestras acciones hoy. Y cuando nosotros pueden quedarse en casa, nosotros tenemos la oportunidad de regresar a estos espacios. Y no hay un experto que sabe la fecha donde y cuándo nosotros podemos regresar a estos espacios, pero es importante regresar y recordar que las acciones de cada persona pueden salvar una vida. Y por la gente que trabaja en estos espacios, los trabajadores en nuestros estadios, en nuestros espacios por conciertos y música, yo quiero ver un día donde ustedes pueden regresar a sus trabajos, y es mi esperanza que juntos nosotros podemos obtener esta fecha este año con sus acciones. Pero si nosotros no continuaremos a parar la contagiación de coronavirus, el resultado será más semanas, más meses y tal vez un año más de este. Pero yo tengo la confianza de la comunidad. I think we have one more Spanish question, una más pregunta en español, and then I'll give some words in Spanish.
Thank you. And our final question in Spanish comes from Victor Cordero from Estrella TV. Please
Hola,
go
Victor.
ahead.
Do we got you, Victor?
Mayor, can you hear me now?
Yeah, we can hear you. Go ahead. Por favor.
Yeah, thank you. I'm sorry if I got disconnected earlier. I'm going to ask the question in English, and then I'll try to do it in Spanish really quick. I know you said at the beginning of the month that if people weren't able to pay the rent because of the situation, you were going to be a little flexible with them. Unfortunately, some people are taking advantage. According to one viewer, she called me and she said that she has a house with 3 units. Her dad is disabled. He cannot talk. He's in bed most of the time. And one of the tenants came to her front house and laughed at her and said that he was going to leave anyway, so he is now planning to leave for free for as long as the situation prevails. It might be a situation where she said, he said, but that's my job. I will investigate. My question to you, Mayor, is what type of guarantees have the smaller landlords, if you will, in this situation where somebody is just not going to pay rent and going to get away with it?
So, hay derechos por los dueños y los inquilinos en Los Ángeles. Y tenemos una prohibición de desalojos residenciales y comerciales en Los Ángeles durante esta crisis. Si usted puede pagar la renta, paga su renta. Es importante por su crédito, por su vida y por estos apartamentos y espacios porque los dueños necesitan pagar sus mortgages también. Segundo, es importante también recordar que los derechos que un dueño tiene y un inquilino tiene están en nuestro Departamento de la Vivienda. El sitio de internet es hcidla.lacity.org. Y toda la información y tus derechos por sus derechos como un dueño, y es la responsabilidad de los inquilinos a pagar, pero también por los inquilinos que tienen malos dueños, es importante tener el apoyo de la ciudad para defender sus derechos. Es igual en los dos, y espero que al nivel nacional tendremos dinero por los bancos con la condición, con ayuda por los dueños de esos edificios, con la condición de ayuda por los inquilinos. Porque los tres necesitan ayuda. Y con un programa especialmente por los inquilinos y dueños, no necesitamos tener esta lucha entre los dos. Y es la responsabilidad de los dos para pagar sus rentas o mortgages, y también es la responsabilidad del gobierno federal ayudar a la gente que no tiene dinero ahora. Pero toda la información está en este sitio de internet, hcidla.lacity.org. Gracias. We have one more English question snuck in. Fox 11, go ahead. Is there one more question from...
That comes to the line of Liz Habib from Fox 11.
Hey, Liz, how you doing? How you holding up?
I'm doing great. Thanks for asking. I'm in my condo in Century City, and we've been doing 7 o'clock every night.
Awesome.
Everyone here has been cheering for all the rescue workers and all the hospital employees. It's been really nice. I heard you mention it yesterday.
Yes.
Or
Thank you
2
for
days
doing
ago,
that.
maybe. Listen, I was looking for the doctors today, so that's interesting. It's convenient they're here. But I heard you say something about the marathon, and I want to ask you a couple questions about it, because
Sure.
it comes up a lot,
Yeah.
the marathon. You said no cases, you're not the only one, Dr. Ferrer said that too, no cases connected to the marathon. So it was, 3 days or 4 days before, the 4th of March, that an emergency was declared. A COVID emergency was declared in California and in Los Angeles County. And the marathon was run 4 days later. And you say there are no cases. So I'm curious, and you said one more thing. This is what caught me. You said that people were spread out in the marathon. And Mayor, I think people would disagree with you. In the beginning of the
Sure.
marathon, they would say that they were so close to each other, they were like in pens before they got to run off. They were crowded in pens. That's how they would describe it. So they were very close to each other. So I'm wondering if 4 days after the emergency was declared, why didn't the marathon cause a problem? Why didn't a big
Sure.
gathering like that cause a problem?
So I'm not a doctor. I can't answer all of that. And I don't think that there's anybody's claim that there's no case of anybody who ran the marathon, but there was no cluster because they do trace back, where have you been, what have you done? And that's the sort of information that our incredible public health department then can kind of mathematically chart and say, oh, here's 5 people who had never met. They don't live in the same area. What did they have in common? Oh, they were together at the marathon, and we have no evidence of that. We do have evidence of that with other folks. We can't share that information because it's private health information, but places that people were, parties that they were at. And I want to remind people the marathon was just one of many public events that still were going on, and there was no place in America where they weren't yet, with the exception, I believe, of Seattle There were folks that were canceling, and the state of emergency wasn't yet that we believed that there were cases here. The state of emergency was to line up for incoming weeks, making sure we could get federal assistance for that. You declare that early to make sure. So I can only go with what we've been told. As I said, you can't, and you never will be able to disprove a negative, but it seems pretty clear that this is not where coronavirus spread. And I know some people fixate on the marathon more than the basketball games that were happening that weekend and other concerts and things like that. But we took a date. I'm proud that it was the earliest date outside of Seattle of any big city to start banning, everything from our bowling alleys to our movie theaters. And if you remember back then, that was really tough to do. People were saying, are you crazy? What are you doing? Are you out of control? What is this mayor doing? And I'm really glad looking back, because you look at the number of cases and now 9 days of single-digit increases. Tragic deaths these last couple days, I will never minimize those, but I think LA can be very proud. We inspired the state to do the same thing and become the first state. So I think we've been making those right decisions, and I have to be honest, I've taken those decisions, whether it was that weekend or since, always talking to our public health officials. I think that's what political leaders should do more. Thanks, Liz. Okay, I'm gonna say a few things in Spanish now as well. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche a la alcaldía de la ciudad de Los Ángeles. Y hoy estoy aquí con 3 personas que representan el espíritu innovador de Los Ángeles. Doctora Carol Folt, la presidenta de USC, el Paul Simon del Departamento de Salud Pública del Condado y profesor de epidemiología I've been said in Spanish before, epidemiología en UCLA, y Niraj Sood, vicedecano de investigación en USC. Todos son parte de sus esfuerzos innovadores para frenar el brote. Primero, les comparto los últimos datos para Los Ángeles. Hoy hubieron 472 nuevos casos en el condado de Los Ángeles, llegando a un total de 10,496. En la ciudad tuvimos 245 nuevos casos, llegando a un total de 4,707. Y trágicamente, hoy fallecieron 42 personas más en el condado. Este es el número más grande durante esta crisis, llegando a un total de 402. Y para las familias hoy, especialmente de estas 42 nuevas familias, nuestros corazones, nuestras oraciones están contigo. Este es un tiempo muy difícil y no tienen la oportunidad de estar con su mamá o su papá, con sus hijos, sus abuelos. Y es un parte de esta tragedia que no podemos estar con nuestras familias durante estos momentos trágicos. Pero en nuestros hospitales tenemos 1,553 camas disponibles hoy. Entre ellas, 244 están en las unidades de cuidados intensivos y tenemos 992 respiradores disponibles. Y seguimos nuestro trabajo para ampliar el acceso a las pruebas de detección. Tenemos ahora 30 sitios para pruebas de detección en la ciudad y el condado, un nuevo récord. Y hasta ahora hemos hecho pruebas a más de 55,000 personas en el condado de Los Ángeles. Si tienes síntomas, puedes hacer una cita inmediatamente para una prueba en la página coronavirus.lacity.org/testing. Yo sé que todos están preguntando, ¿qué pasa después? ¿Cuándo podremos regresar a la vida normal o ir a ver un juego de básquet o fútbol? Ayer el gobernador Newsom anunció sus metas y requisitos para abrir nuestra economía de nuevo. Y esta noche quisiera también compartir 6 factores que considero importantes para tener en cuenta aquí en Los Ángeles y por todo el país para poder regresar a una sociedad sana y próspera. Primera, pruebas. El acceso a pruebas tiene que ser amplio para todos con o sin síntomas. Debemos tener pautas nacionales rigurosas para la calidad de las pruebas y el apoyo federal para obtenerlas. Segundo, vigilancia para identificar y evitar nuevos brotes. Esto se trata de integrar los resultados de las pruebas con una red de vigilancia para poder tomar acción inmediata en nuevas zonas de propagación. Tercero, necesitamos una respuesta inmediata para nuevos casos. Esto significa poder aislar casos y poner a personas sin inmunidad en cuarentena. Y tendremos que intentar quizás hasta 300,000 personas para implementar este trabajo en los Estados Unidos. Cuarto, ampliar nuestra capacidad en hospitales a nivel local, tanto como al nivel nacional. Quinto, asegurar investigación continua para que nuestras universidades, laboratorios, agencias gubernamentales puedan colaborar de manera más fácil y compartir información rápidamente. Y de último, lo central es la capacidad de hacer pruebas de sangre para poder medir los anticuerpos y entender qué significan esos niveles para la inmunidad. Para lograr esto, necesitaremos colaboración extensa entre todos los niveles del gobierno y el sector privado. Además, esta noche estoy orgulloso de anunciar un nuevo programa para ayudar a una de nuestras comunidades más vulnerables, nuestros abuelos y abuelas, personas de tercera edad. Estamos colaborando con el Mayor's Fund de Los Ángeles y Every Table para brindarles comida sana para las personas mayores de bajos recursos quienes lo necesitan. Si les interesa participar en este programa, por favor, llámanos al 213-263-5226, empezando mañana entre las 9 y las 5 para empezar el servicio la semana que viene. Hoy es el 15 de abril, mejor conocido como el Día de Impuestos, pero este año se ha extendido la fecha para el 15 de julio. Hemos oído que algunos se preocupan porque piensan que esta nueva fecha les retrasa el recibir su pago federal CARES. No se preocupe. Lo recibirán aunque no han declarado sus impuestos. El IRS calcula cuánto recibirá basado en su declaración del 2018. Además, si no declaras tus impuestos porque no ganas suficiente, puedes declarar este año para recibir hasta $1,200 por cada adulto en su hogar y $500 para cada hijo. Este es muy importante y este es su dinero. Ustedes se merecen este dinero. Visita lamayor.org/free tax prep para saber más sobre cómo nuestros socios pueden ayudarte a recibir este dinero. Esto incluye a más de 82,000 beneficiarios de DACA que viven en el área de Los Ángeles. En esta pandemia, todos deben sentirse seguros de buscar ayuda médica y no podemos tener trabajadores esenciales como miedo al ir al trabajo. Por eso también envié una carta al Departamento de Seguridad Nacional con 52 alcaldes, pidiéndoles que mantengan protecciones para jóvenes DACA y que renueven su autorización para trabajar en los Estados Unidos. Como un nieto de un inmigrante, esto es parte de mi alma y ellos merecen su estatus legal aquí en los Estados Unidos. También hoy anuncié el Grupo Global de Alcaldes para Recuperación COVID-19, un grupo de alcaldes quienes se ocuparán de pensar en cómo acelerar el recuperamiento de una economía sostenible después de esta pandemia. Amigos, quédense en buena salud, quédense protegidos y quédense en casa. Mucha fuerza y mucho amor. Gracias. See you tomorrow.
The Great Black Way and The Warmth of Other Suns, R.J. Smith and Isabel Wilkerson. These books also share the history of Black Los Angeles. Now, these two books are rare. The one on the left is LAPD's Black History, written by Homer Broom, the first Black commander. Out of print, but beautiful history. And I was fortunate that Homer was a friend of my father, and I got the book. And the Old Stentorians book. It's out of print, but we're working on trying to get copies of it. Some of you may have heard of a gentleman named Montel Williams, a talk show host. Well, his dad, Herman Williams, was one of the first Black firefighters